Hi and welcome to Heal My Hemorrhoids. In this video you will learn how to know if you have hemorrhoids and what to do if you have them. So watch the whole video to the end to get all of the tips you need to heal and prevent from getting hemorrhoids. Remember to hit the subscribe and like button if you get help from this video. How to know if you have hemorrhoids. After a bowel movement, if you feel pain in the anus area and see blood in the toilet or on the tissue, you may be pretty sure you got hemorrhoids. Another sign is if you feel small lumps around the anus area, you might have hemorrhoids. This is not the end of the world. Curing hemorrhoids in the early stages does not need to be so hard. Hemorrhoids, also known as piles, refer to swollen veins found around your lower rectum and anus, the same to varicose veins. They can grow under the skin around your anus or in the rectum. Hemorrhoids that grow inside the rectum are called internal hemorrhoids, while those that develop around the anus are known as external hemorrhoids. Approximately 3 out of 4 adults might have hemorrhoids in daily life. Although in another reason, everybody has hemorrhoids, clusters of veins that look like pillows found beneath the mucous skin covering on the anus and lowermost section of the rectum. The situation that most people refer to be hemorrhoids grows when the veins swell and become distended, the same as varicose veins found inside the legs. Since the blood vessels that are involved must consequently battle gravity to return the blood back into the heart, some persons trust that piles are among the payment we give to be upright beings. Hemorrhoids have several causes, although the apparent cause has not yet been discovered. How to know if you have hemorrhoids is when it is difficult sitting and severe itching in the back. Even though hemorrhoids are very painful, they cannot be said to be life-threatening. They mostly disappear on their own even without treatment. It is so fortunate that significant options are readily available to cure hemorrhoids. Many individuals get cured with lifestyle changes and home treatments. How to know if you have hemorrhoids or symptoms and signs of hemorrhoids always depend on which type of hemorrhoid. Internal hemorrhoids and what they are. They lie inside the rectum. You usually cannot feel or see them, and they barely cause any feeling of discomfort. For instance, you may notice blood on the tissue paper when wiping your anus after passing stool. This may be as a result of internal hemorrhoids. Rubbing frequently may worsen the condition of hemorrhoids. Although irritation or straining while passing stool leads to bleeding during bowel movements, which are painless. You may see little amounts of light blood on your toilet paper in the toilet. A protruding or prolapsed hemorrhoid that pushes through the opening of the anal canal, which results in irritation and pain. External hemorrhoids and what they are. These are the hemorrhoids found under the surface of the skin around your anus. They are the most troublesome and most common. Symptoms and signs may include bleeding, discomfort and pain, irritation or itching inside your anal region and swelling near the anus. Thrombosed hemorrhoids and what they are. When the blood in an external type of hemorrhoid forms a thrombus or clot, it can cause inflammation, severe pain, swelling and sometimes a hard lump around your anus. Causes of hemorrhoids. Traditionally, hemorrhoids are related to straining when passing out stool, chronic constipation, and extended sitting, especially on the lavatory. They all interfere with the flow of blood to and from the area, making it enlarge and pool the blood vessels. This also gives an explanation of why pregnant mothers are prone to developing hemorrhoids. Most recent research highlights that patients inclined to be having a greater inactive anal canal nature, meaning, the tender anal canal muscle seems to be snugger than usual, even when it is not straining. Also, constipation worsens these troubles since straining during the bowel movements raises stress into the anal canal and forces the piles alongside the muscle called the sphincter. Lastly, the connective body tissues that hold and support hemorrhoids in a place may weaken as you age, making hemorrhoids collapse and bulge. A few methods how hemorrhoids can be diagnosed. First one is digital rectal exam. Often, hemorrhoids can be detected from an easy physical exam or medical history. The external type of hemorrhoids is normally clear, mostly if there is the formation of the blood clot. Your doctor may conduct a digital rectal test to see if there is the formation of blood in the stool. Additionally, an examination can be done visually under the skin around your anus, although it is not enough. To be sure about the diagnosis, your medical practitioner may perform another examination to look for any abnormalities around or within the anus. This is known as a digital rectal exam. Second one is a sigmoidoscopy test. If they notice any abnormality, they may additionally do a sigmoidoscopy test. The sigmoidoscopy test involves your medical practitioner using a camera to check for internal hemorrhoids. That fiber optic camera is in a small tube that the doctor inserts into your rectum. It is from this test where your medical practitioner gets a clear view of your rectum from the inside, which helps them to examine hemorrhoids closely. Third one is a anoscopy test. Your doctor may also do an anoscopy test, which involves using a small plastic tube known as anoscope to look inside your anal canal. Fourth one is a colonoscopy test. Colonoscopy is another important test that your medical practitioner may decide to take. The doctor checks on all your large intestine with a flexible, long tube known as a colonoscopy. They can also include tissue samples or cure other abnormalities they find. What treatments are there to heal hemorrhoids? Symptoms of hemorrhoids or how to know if you have hemorrhoids often disappear on their own. Your medical practitioner's treatments will accord with how dangerous your signs are. Home remedies. Simple changes in lifestyle behaviors can usually heal mild symptoms of hemorrhoids within a period of 2 to 7 days. If you are constipated, you can take over-the-counter fiber supplements to soften your stool. The two most commonly used supplements are methylcellulose and psyllium. Make fiber your normal diet, including essential supplements and other foods like vegetables, fruits, and grains. Avoid straining during bowel movements. Taking more glasses of water can let your stool pass easily. Warm sit baths for a period of 20 minutes several times a day can also make you feel much relieved. Ice cubes can relieve swelling and pain. If the pain is exceptionally too much, get over-the-counter medical cream or ointment to release much pain and burning. Practice better hygiene by washing your anus with warm water during a bath or shower every day. Avoid using soap, since soap can worsen hemorrhoids. Do not use rough or dry tissue paper when wiping after passing out stool. The use of a cold compress on your anus can significantly reduce hemorrhoid swelling. Painkillers such as ibuprofen, aspirin, and acetaminophen can also relieve discomfort or pain. Surgical treatments that can be used for hemorrhoids. When you notice big hemorrhoids, or if you have not improved from other treatments, the doctor may refer you to surgery. They can use lasers, chemicals, infrared light, or small rubber bands to treat them. These treatments a doctor can use. Rubber band ligation. The rubber band ligation procedure involves the medical practitioner doing away with the circulation of hemorrhoids by putting a rubber band near it. This results in loss of movement of hemorrhoids, imposing them to become small. This procedure is only done by a medical specialist. Do not try it by yourself or while at home. Sclerotherapy procedure. In case this procedure is not a choice, your medical professional may opt to do sclerotherapy or injection therapy. In this form, if treatments, the medical professional introduces medicine into the blood vessel directly, which makes hemorrhoids become small. If they keep coming back, or they are threatening big, your medical practitioner may require to remove them permanently using a sharp tool known as a scalpel. Barium X-ray. Additionally, your doctor may take a barium X-ray, which can display the outline of your entire colon. Firstly, you will get a barium enema, and then the doctor will consider several X-rays of your lower gastrointestinal area. Non-surgical medications are, chemist medications and other treatments relieve swelling, pain, and itching. They include creams such as hemorrhoid cream and hydrocortisone, which can ease discomfort from hemorrhoids. Look with your doctor if you still have signs after 1 week of using these medications. Treat the blood clot. When an external type of hemorrhoid forms a clot, the pain may be extreme. If it is unbearable and the clot has existed for a period lengthier than 2 days, smear home medications for the signs while giving it time to disappear by itself. If the blood clot has not stayed for too long, hemorrhoids may be done away with surgically, or the blood clot can be removed from the varicose veins in a mere office method conducted by a medical doctor. How to know if you have hemorrhoids and when to seek medical attention. If you notice bright red bleeding during the bowel movements, or you have had hemorrhoids that have shown no improvement after 1 week of home treatment, talk to a medical practitioner. Never assume that rectal bleeding is caused by hemorrhoids, especially if your stools change color and consistency or changes in bowel behaviors. Rectal bleeding might be caused by other ailments such as anal cancer and colorectal cancer. Seek medical attention immediately if you get feeling of lightheadedness, faintness, dizziness, and big amounts of rectal bleeding. Causes of hemorrhoids. Veins around your anus may have a tendency to stretch under pressure and may also swell or bulge. Hemorrhoids can grow from increased pressure inside the lower rectum because of pregnancy, obesity, strain during bowel movements, having constipation or chronic diarrhea, sitting for long in the toilet, anal intercourse, eating low-fiber diets or frequent heavy lifting. The risk of getting hemorrhoids increases as you get older. Studies highlights that nearly 50% of adults suffer from hemorrhoids at the age of 50 years. That is because the particular tissue that holds the veins inside your anus and rectum can stretch and weaken. This can similarly happen when you are pregnant since the baby's weight adds pressure to your anal region. Hemorrhoids complications are rare, but they include blood clot. Most often, a blood clot can form in hemorrhoids, which is known as a thrombosed hemorrhoid. Though it is not dangerous, it can be excruciating and it can mostly need to be drained and lanced. Anemia. Chronic blood loss brought in by hemorrhoids can cause anemia, which means that you do not have enough healthy blood cells responsible for carrying oxygen to your cells. Strangulated hemorrhoid. If the supply of blood to internal hemorrhoids is cut off, it may be strangulated, which can result in too much pain. Prevention of hemorrhoids. The perfect way of preventing hemorrhoids is by keeping your stools soft for them to pass easily. To reduce the signs and symptoms of hemorrhoids or to prevent hemorrhoids, observe the following tips. First tips. Take plenty of liquids, drink 6 to 8 glasses of water and other fluids, not alcohol, daily to help you keep your stool soft. Second tips, take high-fiber foods, eat more vegetables, fruits, and whole grains. By doing so, stool softens and increases its bulk, which will help you avoid straining while passing stool, which causes hemorrhoids. Make sure you consume fiber as your regular diet to prevent problems related to gas. Sources of good dietary fiber food include bran, carrots, buckwheat, oatmeal, brown rice, whole wheat and pears. Third tips. Avoid straining. Holding your breath and straining while trying to pass stool can create much pressure in the veins found inside the lower rectum. Fourth tips. Avoid sitting for a long time. Sitting for too long, especially on the toilet, raises the pressure on the veins inside the anus. Fifth tips. Exercise. Do exercises daily to help you stay active, prevent constipation, reduce pressure on veins, which occur because of long periods of sitting or standing. They can also help you lose excess weight that might be contributing to the development of hemorrhoids. Tips number 6. Go to the toilet immediately when you feel the need. If you delay passing a stool and the need disappears, it might dry out, which can make you strain during a bowel movement. Tips number 7. Prefer fiber supplements. Many individuals do not get enough of the suggested quantity of fiber, 20 to 30 grams in a day included in their diet. Researchers have highlighted that over-the-counter supplements of fiber, like the Metamucil, or Psyllium, or the Citracel can improve bleeding and overall symptoms of hemorrhoids. If you frequently eat fiber supplements, make sure you also drink 8 glasses of fluids or water daily. Otherwise, the fiber supplements can worsen constipation or even result in it. How to know if you have hemorrhoids? With the appropriate method, you will likely notice an improvement. Carefully following your doctor's prescriptions and keeping a routine, exercising, and avoiding sitting for lengthy periods, reduces hemorrhoid signs and can improve your appearance. Thanks for watching. Don't forget to hit the like button and subscribe for more videos. I hope the video was helpful for you. For more articles and videos, go to healmyhemorrhoids.com or this YouTube channel.